Medicare can be confusing, and we're here to help guide you through it. My name is Janet. I'm with Weaver & Associates. I've been providing Medicare services for over 15 years. If you or someone you know is reaching 65, it's important for them to understand the Medicare process. Medicare is made up of 4 primary parts. Part A for hospitalization. Part B for outpatient services. Part C speaks to Medicare Advantage. And Part D, prescription drug coverage. Part A is automatically provided at no cost to you or your spouse have had 10 years of work history. You should receive a Medicare ID card from the government via physical mail around your 65th birthday. This coverage picks up 80% of hospitalization costs, and you're responsible for the other 20% with no cap on out-of-pocket expenses. For Part B, it's very important that you reach out to Social Security Administration 3 months prior to your 65th birthday. Each individual must reach out for themselves. You cannot reach in for your spouse or any other family members. This coverage picks up, again, 80% of outpatient services, and you're responsible for other 20% with no cap on out-of-pocket expenses. There is a monthly cost associated with electing Part B coverage. Once you've enrolled in A and B, you're ready to rock and roll with me and talk about additional Medicare products to meet your coverage needs. Part C is an alternative to utilizing A and B. This option combines both hospitalization and outpatient services into a private health plan, 99% of which fall under HMO, with one limited PPO option currently in California. This option is still subject to co-pays, co-insurance, and annual deductibles, and is limited to a specific medical network. This option does include your Part D prescription drug coverage. A benefit to Medicare Advantage is that it recaps or caps your out-of-pocket expenses. There's typically no additional premium for enrolling in Part C. Medicare Supplemental coverage, or Medigap, is an alternative to Part C in which you keep your original Medicare A and B and remove the 20% co-insurance. This is the most robust coverage option available in Medicare because you're not limited by networks, co-pays, co-insurance, or annual deductibles. This is the broadest coverage. It's also the costliest Medicare option. Part D is something we recommend purchasing at age 65 regardless if you take any prescription medications, because if you don't enroll at 65, there is a late enrollment penalty applied. Part D is a limited drug coverage that operates and resets every calendar year on January 1st. This benefit is for 2021, $4,130. You're responsible for a percentage instead of a copay. If you reach the out-of-pocket maximum, you'll enter the catastrophic phase, which reduces the out-of-pocket expense for your drugs to 5% of the drug cost. There's many options for drug plans and coverage. Recommend scheduling a meeting to discuss your current status, your annual cost projection, and better answer any questions you may have. Common misconception is that everything is covered under Medicare, and unfortunately, this is not the case as we frequently see uncovered claims. I realize this can be confusing, and I look forward to meeting with you to help simplify the process.